Good morning. Today we have with us Anjelo Ratnachandra, chronic pain management physiotherapist. Good morning and welcome, Anjelo.
Good morning.
Anjelo, when you talk about pain management and physiotherapy, that's a bit different. What does it really mean?
Well, when I talk about pain management, I'm talking about chronic or complex pain conditions. So when someone comes to me with a chronic pain or a complex pain condition, I don't just look at the injured body part, I look at the whole person. So I look at how the pain has affected them from a personal point of view, from a social point of view, and if they're working from a work point of view, and help them get their life back so that the pain's not controlling them, but they're controlling the pain.
Just quickly, when you say complex pain, what does it define to a layman?
Complex pain means, you might have pain in more than one part of your body. It could be your back and going out to your arms, or it could be you've had multiple surgeries and your pain is all over your body. So it's not just in your arm or in your knee or in your hip. And it could be complex conditions like chronic regional pain syndrome, as some people might call it.
And you're an authority on this because you suffered from quite a few horrific injuries and got over all this. Would you want to, give us a brief summary of what you've been through?
Sure. So from personal experience, I understand what it's like to live with pain on a regular basis. Back in 2006, I was sitting at home. I was in London at the time working. I was sitting at home watching TV and I was hit with a petrol bomb. It was a case of mistaken identity and I suffered second and third degree burns. Yep. And 8 months prior to that, I had a collapsed lung and I had to have life-saving lung surgery. So I've got a few scars.
So you've been at the end of where your patients should be, really.
Exactly. I definitely understand what patients go through, and I think that allows me to empathise with the patient or empathise with my clients a bit more or at a different level. And it's not taking away from any other physiotherapist, because I think you can be a very good physiotherapist and not have chronic pain yourself, but I think it allows you to reach people at a different level when you understand what they're going through.
It's not only empathy, but also the physical reality that you've been through, that you can understand how to. Does that help with your treatment as such?
Charlie, absolutely. When I design a rehab program, I often look back at my own experience, and but I'd like to tailor that rehab program for that individual. So for me, when I was going through my rehab, I always wanted to achieve my goals despite my pain. So a lot of my programs are around what people want to achieve, what they want to get back to, and then we set up a program to allow them to achieve that.
Also, recently, I mean, if you don't mind, letting us know, you got over a really bad or a cancer that is very rare as well, isn't it?
Yes, in 2011 I was diagnosed with a very rare cancer called a leiomyosarcoma. I was told the chance of getting that is less than 1%. So again, it's about the rehab and the mindset. So I'm fortunate I didn't have to go through the chemotherapy and other sort of radiation therapies. They did surgery, and I'm now going back for every 6 months checkup.
So that's why you've been able to, get back and do this book called Beyond Pain.
Yes. So the reason for the book, the inspiration came really when I was talking to one of my friends. She was a breast cancer sufferer, and it was an Australian lady, and I'd known her for a long time. And when I was talking to her when I got back from London about what she could do and what she was up to, she said, Angelo, why don't you write a book? Because not many people have told me what you told me, and it's really helped. So that sort of inspired me to write a book, because I just felt that I could reach more people and help more people with really basic strategies that often people take for granted or not really understand.
Is it just a clinical book, or is it a book that gives you a way to get over pain? Is it?
Oh, absolutely. It's a very unique book. It's the first of its type. It's not clinical at all. It's very, very easy to read. The first part of the book is actually my own story, so you get an understanding of what I've gone through. The second part of the book is an understanding of what pain is and the things you need to consider. It talks about what do scans and x-rays really show us, how does the body heal itself, and what does pain really mean, and how does it work in the body. Because for me, I think if you understand a condition, then you're going to be more confident dealing with it. And I think that's the problem in today's society, is that often with pain, people don't understand and they go for all these scans and they're none the wiser, and therefore they develop a fear around what it is, what it can do to them. So the second part of the book is really giving a good understanding and a really a basic but yet essential understanding of what it is. And then the third part of the book is an 8-week program where week by week you just follow what the book has to say, and that'll help you get your activity levels back and get you fitter and stronger, yeah, both mentally and physically.
So you talk about the mental aspect of pain. You know, players coming in, you know, all the time saying, "Ma'am, I have this little niggle that keeps going." Is it, how do you really look at that? Is it a mental thing? Is it a physical thing? What's your take on it?
When someone has pain, pain by definition is an experience, and it's both physical and emotional. When I say emotional or mental, I'm not meaning that it's in your head and you're imagining it. Absolutely not. It's very, very real. The problem with most pain conditions is it doesn't come up on a scan or x-ray because we don't have a test to show pain. So when I talk about mental or emotional pain and how it affects physically, is that, you know, take for example, often a lot of people say when they're stressed or upset or worried, they always say that the pain tends to be higher. But if they're playing with their grandkids or having fun with friends, they say that the pain not so bad at those times. So the body has chemicals that it releases when you're in a good mood, and it has chemicals that releases when you're not in a good mood, and those chemicals can act on the pain to either increase it or decrease it.
And so when you treat patients, do you do the psychological side of it or just the physical side of it?
I definitely tap into the psychological aspects as well. I'm not a psychologist, but certainly I've been trained to identify if someone's scared to doing an activity or the body's resisting. And I often talk through it with them. I'm quite comfortable doing that, and you know, I'm not one to quick jump in and do the hands-on, because I think it's really important to get an understanding of what that injury or pain means to an individual. So I do spend time helping them overcome that fear or the anxiety towards an activity or a movement, together with the physical aspect of it, which exercise, stretches, and so on and so forth.